Pre-Congress interview series. My name is Fernanda Arce and I am the ISN Social Media Manager. Today, we are honored to have with us Dr. Urmila Anandh. Trained in nephrology at Christian Medical College in Vellore, India, Dr. Urmila Anandh has been involved in developing tertiary care nephrology services in Bangalore, Mumbai, and Hyderabad. She runs a successfully postgraduate nephrology training program and is a subject expert in nephrology for the National Board of Examinations in India. Her area of interest is deceased donor and ABO-incompatible transplantation and critical care nephrology. She has been a fellow of the ISN and the International Society of Peritoneal Dialysis and has received many Young Investigator Awards from the ISN and the ISPD. Currently, she is a member of the ISN CME Committee and the South Asia Regional Board of the ISN. She has more than 80 publications in national and international journals. Welcome, Dr. Anandh. Thank you for being with us today. It is my pleasure to be the person who interviews you.
Thank you, Fernanda. It's a pleasure talking to you because I know you for years together. You have been a big source of inspiration for us. Your efficiency, your hard work, and the commitment that you show to us and International Society of Nephrology is really, really inspiring for all of us. Thank you, Fernanda. Thank you very much.
I am the one who's honored. So let's start with this interview. I want to ask you first, how did you get into this field of nephrology and all the incredible work that you do?
See, nephrology was interesting. I was trained for my medical MD medicine in All India Institute of Medical Sciences, India's premier institution, and we used to see a lot of patients. And we were made to read a textbook called Harrison. And in Harrison, nephrology was the shortest, 100 pages. So I thought if I take a subject, it should be the least of a hard work. So incidentally, it just happened because there was so much of workload. I wanted to do something which is a little lighter. That's one. And interest in transplant is because of my training. I trained in Christian Medical College, Vellore, which I think you should know was the center which had the first successful renal transplant in India. We just celebrated 50 years. 2nd February was the day when we had 50th year of our transplant. So our training, actually, there was a whole lot of transplant exposure. So that made us interested in transplantation.
That's great, and that's very inspiring. And being able to talk to you about this in World Kidney Day week, it's amazing. So what are you working on now?
A basic work now is actually with nephrology wise, our major area of interest is deceased donors. So that takes more time. Last month, as you realize, we had about 35 multi-organ transplants. So our clinical work is now devoted with transplant work. But we are also looking into some basic work. In Indian Institute of Sciences, we have developed a point of care device for diabetic kidney disease. So that is one area which we are working into. But something which I'm very excited about is we are trying to look into the various types of diabetic kidney disease and look into its genomics, proteomics, and metabolomics. In India, Fernanda, doing translational research is very difficult. We have so much of clinical work, but now over the last year or two, there has been a synergy between technological institutions and our medical field. So we are now going into working together with our Indian Institute of Technologies and Indian Institute of Sciences and develop some kind of technology driven work for our patients. And as you know, in India, diabetic kidney disease is very important. So that's an area which we are working on now.
That's very inspiring. And I can tell that even though we are on the opposite side of the world, our countries are very similar on.
Yes.
And that leads me to ask you, what inspires you?
People like you. Honestly, the hard work that you all put on, and to see that how you you put in your efforts. And you know, I don't want to sound a little yay, but being a woman and the amount of work that you all do really inspires us. I'm being honest with you. And of course, my patients. So all the women I see, and I'm grateful to them. You all are the amount of hard work in your own way are role models for me. So that inspires me, honestly. All the
It,
ladies out there. That's all I think.
it is mutual. It is mutual for
I
sure.
know. So we all, I mean, I see all of you, and the same thing with our part of the world. Things are so difficult. We have had a lot of gender disparity, gender equality, but to come out of it and to bring together people the way you do, I have seen you manage a whole lot of disparate people and make the social media team of International Society of Nephrology, so successful. And I see your work from the back. That inspires all of us. And I wish you inspire many of us in the future also. That's all I think.
Thank you, thank you. And I look forward to being able to meeting you again soon.
Yeah, we'll do that.
And that leads me to my last question. We are living unprecedented times due to the pandemic, and this is part of it. We have to connect remotely and not being able to, hug each other, touch each other, and for your patients as well. So, can you give us a glimpse of your session during WCN?
Yeah. See, I think this is a very interesting initiative that we get a glimpse of it, what is happening beforehand, so that we get an idea what's happening. See, our session is special. The session about the impact of hemodialysis on and other areas because of COVID-19 in low and medium income countries. So, first of all, it's an opportunity to share our travels, our trials and tribulations. There were two things. One is basically the impact of the virus on patients on hemodialysis. And even though in India the mortality is about 1%, our hemodialysis patients who got infected with COVID 19, actually the mortality was anywhere between 38 to 40%. That was scary. But the other area which I think we all missed is the non medical impact of hemodialysis. This lockdowns, the sudden onset of change of the scenario, patients not being able to come to hospital, and not having a private transportation to come from home, from remote areas to hospital, really impacted hemodialysis services. You will realize during my session, the mortality that we had almost doubled during the pandemic compared to 2019. And this is not because of the viral infection. This was more because of people not being able to uh, attend or access their services. I think this has been there everywhere, but it was much more stark and had a much bigger impact in low and middle income countries. So that is what we are going to discuss, and I'm sure we learn lessons out of this and hope in the future we will be able to manage such eventualities.
I do agree, and I do look forward, as well as all our delegates, to attend your session. I know that it's a low middle income country focus session related to COVID and hemodialysis services, so we look forward to attending, and we wish you the best. Please stay safe, and thank you for being with us
Thank you,
today.
Fernanda. Stay safe, take care. We would like to meet you. Thank you very much.